Hi class! I'm here to teach you about HIV drugs. What do you need to know about HIV? Human immunodeficiency virus is a retrovirus, meaning it must attach to a host cell in order to replicate. Antiretroviral agents are used to treat HIV infections. ARVs do not cure HIV and do not decrease the risk of passing HIV to others. Some ARVs act by preventing the virus from entering cells. Others inhibit enzymes needed for HIV replication. Highly active antiretroviral therapy uses 3 or more different antiretrovirals in order to fight the virus and increase CD4 counts in the body. This can then reduce medication resistance, adverse effects, and dosages. The drug classes are 1. Fusion entry inhibitors, 2. CCR5 antagonists, 3. NRTIs, 4. NNRTIs, 5. Protease inhibitors, and 6. INSTIs. Fusion entry inhibitors decrease and limit spread of HIV by blocking the virus from attaching to and entering CD4 T cells. This drug is particularly used to treat HIV that is unresponsive to other antiretrovirals. Enfuvirtide is one of the drugs in this class. It is given subcutaneously. Adverse effects include localized reaction at the injection site, bacterial pneumonia, fevers, rash, chills, and hypotension. It is contraindicated in those with medication hypersensitivity and those who are breastfeeding. It is pregnancy risk category B. There are no significant interactions with this drug. CCR5 antagonists prevent HIV from entering lymphocytes by binding to CCR5 on cell membranes. They treat HIV infections in conjunction with other antiretrovirals. Maraviroc is a drug in this class and is given orally. Adverse effects include cough, upper respiratory tract infection, dizziness, paresthesias, orthostatic hypotension, hepatotoxicity, and pseudomembranous colitis. It is contraindicated in those with renal impairment. It is pregnancy risk category B. Here is a list of drugs that decrease Maraviroc levels, and most protease inhibitors raise Maraviroc levels. NRTIs reduce HIV symptoms by inhibiting enzymes needed for HIV replication. They are the first-line ARVs to treat HIV infection. Zidovudine is a medication in this class. Adverse effects include suppressed bone marrow resulting in anemia, lactic acidosis, hepatomegaly, thrombocytopenia, nausea, vomiting, and diarrhea. It needs to be used cautiously in clients who have liver disease and suppressed bone marrow. It is pregnancy risk category C. Probenecid, valproic acid, and methadone increase levels. Rifampin and ritonavir reduce them, and ganciclovir further suppresses bone marrow when taken with zidovudine. NNRTIs act directly on reverse transcriptase to stop HIV replication. Medications in this class include nevirapine, efavirenz, etravirine, and delavirdine. Adverse effects include rash, flu-like symptoms, dizziness, drowsiness, nausea, and diarrhea. It is contraindicated in those with severe liver disease, kidney disease, and those who are pregnant. Antacids decrease the absorption of NNRTIs. NNRTIs increase the effects of benzodiazepines, antihistamines, calcium channel blockers, and warfarin, and they decrease the effects of hormonal contraceptives. Protease inhibitors act against HIV-1 and HIV-2 to alter and inactivate the virus by inhibiting enzymes needed for HIV replication. They are usually used in combination with 1 or 2 reverse transcriptase inhibitors. Medications in this class include ritonavir, saquinavir, indinavir, fosamprinavir, melphinavir, and iopinavir-ritonavir combination. All of these medications are given orally. Adverse effects include osteoporosis, diabetes, hypersensitivity reaction, nausea and vomiting, hyperlipidemia, altered fat distribution, and rhabdomyolysis. There are many contraindications for this drug class. Thus, clients must notify their provider before taking any additional medications. It is pregnancy risk category B or C. Protease inhibitors cause many medications to rise to toxic levels and can increase the levels of some antihypertensives. They decrease the levels of oral contraceptives, while phenobarbital, phenytoin, carbamazepine, and St. John's wort all reduce levels. Integrase inhibitors interfere with the enzyme integrase to prevent HIV replication within the cell. They are the first-line treatment when combined with 2 or 3 other antiretroviral medications. A medication in this class is raltegravir. It is given orally. Adverse effects include headache, difficulty sleeping, skin rash, liver injury, renal failure, hematuria, and suicidal ideation. It is contraindicated during lactation and needs to be used cautiously in clients younger than 16, older adult clients, or clients with liver disorders. It is pregnancy risk category C. Rifampin or tipranavir-ritonavir combination can decrease the levels of integrase inhibitors. Now you are ready to get all these questions correct on the NCLEX, right?
Ugh! No!
Oh gosh, okay, how do I fix this? I have an idea! I'll teach you some mnemonics to remember the drugs. Drug class 1, enfuvirtide, a fusion entry inhibitor. Think of a man trying to inhibit entry of the tide onto the shore. Enfuvir, tide, a fusion entry inhibitor. Drug class 2, maraviroc, a CCR5 antagonist. For maraviroc, think Ma in maraviroc and CCR5. Mono, Ma, means hand and has 5 fingers. Drug class 3, zidovudine, a nucleoside reverse transcriptase inhibitor, NRTI. Zidovudine. For this one, think of Zidu the zebra went on a journey to Voudine where he bought NRTIs. Drug class 4, nevirapine, efavirenz, etravirine, delavirdine, non-nucleoside reverse transcriptase inhibitors, and NRTIs. For this drug class, focus on the first letter of each drug name, NEED. Never, ever, ever deliver nucleosides. This is a good way to help you remember that NNRTIs are non-nucleoside reverse transcriptase inhibitors. For drug class 5, the protease inhibitors, all of the drug names end in navir. The way I like to remember these is with my favorite Taylor Swift song. We are navir, 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 getting protease back together. Drug class 6, raltegravir, integrase inhibitors, INSTIs. This one's pretty easy to remember. The word tegra can be found in integrase and also in raltegravir. Now you know a little more about HIV drugs. Good luck on the NCLEX!